Hello, welcome to the Hat on Head News Cabin. Today, Tuesday, April 7th. It's 10 a.m. here on the East Coast. In Boston, the first stay-at-home order was supposed to be lifted today. So yeah, we're just deep into this quarantine. It's a strange time. People are really having trouble being locked at home. A lot of different reactions of just people having trouble. So we're going to see how long we can last, how long this goes forward. Today we're going to take a look at just the Worldometers numbers, going to talk to you about some differences, about how these numbers are being reported, and how in general all the statistics that we're getting might be not accurate. So even though we are tracking a lot of what's going on in a lot of different countries, one specific difference is, and I'll talk about this when we look at the numbers, but Germany is not reporting their COVID-19 deaths as COVID-19 deaths. And we can clearly see that with the difference between Germany and France. And so I have family in Germany and family in France. Lived over in a small town in Germany for 2 years, and my home Bingen, and just so I get information from there about the different things that are going on in Germany and in France. And yeah, so we'll just get right into it. Hope everyone's doing all right here. The quarantine blues have set in for most of us. The routine and just being stuck at home is a challenge, and it's really hard. So all right, we're going to take a look at things here. So that is the daily cases, 76,000 deaths. This one. So it's down basically, so we're down from the peak. Hopefully we don't go back up there. And if that's the case, if this was the peak, then this is far less than what we had been talking about with the predictions of, 1 million American deaths. Those are way higher than what we're looking at here. My prediction of 10 days ago was worldwide 400,000 deaths. I guess that I would probably bring it down from there, but there we are. So I want to look at the mortality rate just because I think this is an important thing for people to look at. So this is what the World Health Organization says as of March 3rd, 3.4% mortality rate. I'm also going to bring you an article, not this video, I'm not going to read this video, but it's going to be about the World Health Organization and how they're being influenced by China. Alright, so this is what we have here, and this I want to take a look at right here. So if you look at the number of deaths, 1,810 in Germany, and in France 8,911, and they have almost the same number of cases, France having slightly less. This is because Germany is not reporting their COVID-19 deaths as COVID-19 deaths. They're reporting it as all of the many different things that the people are also dying from in those, because COVID-19 is killing people who have, as we know, pre-existing conditions and have a number of other issues. And so basically Germany is, I'm going to follow this story further because it's pretty interesting, because it's exactly, what we're talking about here at Hat on Head News is looking at the data to understand what's going on. And if Germany isn't giving us the correct data, just like China isn't, then, we have to figure that out. I obviously think that, these are two completely separate cases of why it seems like we're not, but, if you look at this also, just this is an unprecedented pandemic, and we're all learning about communication between countries, and there's it's not probably, it's just there's so many great connections that are being made right now in the healthcare field, in hospitals, and then within, as we were talking about, infectious disease investigation. And so we will see, and I'm sure that this right now is being hotly debated. Why is this difference in reporting? Is it helping? What's the point? Another difference that I'll talk to you guys about right now is the way that Germany and France are restricting people's movement. So there is a story, and this is happening, where French police are tracking down French hikers who are basically, they're going on hikes, right, to just get away from their house. Everyone's losing their mind. And they're going up there with helicopters to track these people down and give them fines. That, to me, is taking it too far, because then you're putting someone else's, they have to get up and get out of their home, they have to get out of confinement, they have to get out of their lockdown that they're doing to social distance, to stop the spread. So it's like taking all of these steps. That type of enforcement, to me, seems a step too far. The Germans, and so in France, you have to be 1 kilometer from your home. That's the enforcement that they have. We don't have that in the US. They don't have that in Germany. In Germany, people are allowed to, and very much are, going on hikes and they're going on hikes, and I'll probably get more information from my friends as to how these hikes are going, but I think that people are having to, on the trail, pay really close attention to be 6 feet away from each other. Now, that is also the reason why the French are saying, hey, you can't go at all on these hikes. And then it's interesting to look at the cultural differences there, and that's causing these different reactions. And to me, what it seems to me is it's an over enforcement, where you have police helicopters tracking down hikers that are breaking the social distancing and stay-at-home orders. So, I mean, really, it's interesting. I mean, obviously, we're in unprecedented time, and people are reacting in different ways, and countries are having different responses, and we're here at Hat on Head analyzing how it all goes down and how it's going to affect us. So it's definitely a time where we have a lot to learn, and that's what I'm trying to do a little bit here with this channel, is analyze what's going on and give you more information. Thanks for joining me here today, and hope you guys have a great day. It is really sunny here in Boston, so if you just open up your window, look outside, and just keep your hat on your head.